Hello, I'm Dr. James Lin, and today I want to talk to you about egg freezing. What is egg freezing? Egg freezing is a way for a woman to preserve her fertility. It allows her to save eggs for now so she can try it for a baby later. Every woman is born with a set number of eggs. As they age, number of eggs goes down, and unfortunately, so does their quality. With egg freezing, we collect eggs while they're still healthy, we freeze them and store them safely. Then, when the time feels right, those eggs can be used to try for pregnancy. Why do women freeze eggs? There are many reasons a woman might decide to freeze their eggs. Some want to focus on their career or education. Others are waiting to meet the right partner. Egg freezing gives them the flexibility to choose when and with whom to start a family. There are also medical reasons. For example, a woman might be preparing for cancer treatment, which can affect fertility. Freezing her eggs beforehand gives her a chance to have a baby down the line. Every situation is different, but egg freezing is about one thing: keeping your options open and having peace of mind for the future. When is the best time to freeze your eggs? The ideal time to freeze your eggs is usually in your late 20s to early 30s. That's when the eggs tend to be the healthiest, and we're often able to collect more of them. You can freeze eggs later, but keep in mind the success rate may be lower. So if it's something you're seriously considering, it's better to act sooner rather than later. You don't have to use the eggs, but having them stored gives you more choices later on. What to expect during the process? The egg freezing process takes about 2 to 3 weeks from start to finish. We begin with some basic tests like blood work and an ultrasound to check your hormone levels and look at your ovaries. Next comes a series of hormone injections. These help your body grow more eggs than usual. When the eggs are ready, we do a short outpatient procedure to collect them. It takes around 15 minutes and is done under light anesthesia. You'll be asleep and comfortable. Most women feel fine after a day or two of rest. Some mild side effects like bloating, cramping, or mood swings are normal, but they usually go away quickly. Once collected, your eggs are frozen and safely stored in our lab until you're ready to use them. Important to keep in mind, it is important to understand that not every egg will lead to a baby. Because we're freezing eggs, not embryos, we won't know which one will be viable until later. Some eggs may not survive the freezing and thawing process. Others may not fertilize or grow into healthy embryos. That's why having more eggs improves your chances. Sometimes one round isn't enough. Many women choose to do 2 or even 3 cycles to build a stronger reserve. Egg freezing isn't guaranteed, but it is a powerful way to take control of your future. If you're thinking about it, the best first step is to speak with your fertility doctor. The earlier you start, the more options you will have later. Thank you for watching. If you have any questions or want us to cover specific topics in another video, leave a comment below. And don't forget to like and subscribe for more helpful fertility information.